Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In the last blog, I talked about part 1 of the 7 most dangerous trends families of critically ill patients are currently facing in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk about part 2 of the 7 most dangerous trends families of critically ill patients are currently facing in intensive care. Before I get into today's topic, and before I continue from last week's blog, I want to share a quote with you that I wrote on today's topic, and the quote says, "A trend is defined as a general direction in which something is developing or changing. It's therefore that you and your family need to be familiar with the latest trends and developments if your loved one is critically ill in intensive care." A trend sounds like it's something fashionable or even desirable. However, when it comes to your loved one's critical illness in intensive care, all you care about is results and outcomes and not trends. Intensive care teams take different stands, and from their perspective, it often is about the latest trends in intensive care and how it applies to your critically ill loved one's care and treatment. The truth of the matter is that the latest trends in intensive care often include medical research and experimentation beyond your imagination that may or may not be in your critically ill loved one's best interest. Your role, as always, is to ensure that your critically ill loved one is getting the best, most up-to-date and free from bias care and treatment. Care and treatment in intensive care must never be a result of what's happening behind the scenes in intensive care, where hidden agendas often rule and result in inferior care and treatment. So let's get into today's topic, where I want to give you the four most dangerous trends from the 7 most dangerous trends families of critically ill patients are currently facing in intensive care. This is obviously to follow on from last week's blog, and as most of you know by now, given that I have worked in intensive care for more than 15 years in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for more than 5 years, I really have some serious concerns about current and ongoing trends in intensive care that I believe I need to share with you. If you don't know about current and worrisome trends in intensive care, I believe that you and your family are in big trouble. The trends I have identified over the many years in intensive care, but I also identify them when I speak to you, the families of critically ill patients in intensive care, in my one-on-one phone or Skype counseling and consulting sessions, or in my one-on-one email counseling and consulting service with you. So let's carry on from last week now. So, number 4. Intensive care teams are the only ones to know what's quote-unquote in the best interest for your critically ill loved one. I have always been amazed, and still am amazed, how quick intensive care teams decide what's quote-unquote in the best interest of a critically ill patient. And again, I'm not talking about your loved one being in intensive care for 1 or for 2 days. I'm talking about some serious stuff here, where your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is not waking up after an induced coma, or is in intensive care for long-term treatments and long-term stays, including long-term ventilation, or is having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or your loved one may be in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment might be quote unquote in the best interest for your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. Those are the situations where the rubber hits the road, so to speak, in intensive care. And those are the situations where you and your family need to be on high alert. Those are also the situations where you and your family need to make informed decisions, get peace of mind, control, power, and influence. Imagine your critically ill loved one is in one of the aforementioned difficult and challenging situations. You certainly don't want the intensive care team telling you what's quote unquote in the best interest for your critically ill loved one. That's BS. And how could they possibly know what's quote unquote in the best interest for your critically ill loved one? Chances are the intensive care team has never met you before, or your family, or let alone your critically ill loved one. Chances are that they don't know anything about how you, your family, and your critically ill loved one live their lives. Chances are that the intensive care team has no idea what possibly could be quote unquote in the best interest for your critically ill loved one, and how could they? However, the truth of the matter is that they claim to know what's quote unquote in the best interest for your critically ill loved one by taking their agenda into account and not yours. Sadly, this is what happens across the board. Think about it. The intensive care team has only known you and your critically ill loved one for 2 minutes, and they have already decided about what's quote unquote in the best interest for your critically ill loved one. Again, I call BS on that. It's a very short-sighted approach. They don't know you nor your critically ill loved one, and they also don't know what their perception of quote unquote in the best interest for your critically ill loved one means in 6 months time, in 1 year's time, in 5 years time. So you therefore really got to pay attention to those things. For example, what if the intensive care team tries and sells you and your family on a withdrawal of treatment and a limitation of treatment as being quote unquote in the best interest for your critically ill loved one, and you give in? What does that mean in 6 months from now, 12 months from now, 2 years from now, 5 years from now? It could literally mean life or death. I really can't stress this enough. The bottom line is that whenever the intensive care team says that they think it's quote unquote in the best interest for your critically ill loved one, it's only their perception that suits the intensive care team and their often hidden agenda. Period. The bottom line is that quote unquote in the best interest for your critically ill loved one is intensive care team speak for it's in the best interest for us because we can stay in control. The choice is yours to challenge the intensive care team on every level to get the results and outcomes that you want and deserve, and I'm, of course, here to help you. Number 5. Intensive care teams keep hiding behind their medical jargon and their expert knowledge. Openness and transparency is lacking. Most intensive care teams are trying to be the smart ones. After all, they are academics, have studied for many years, and are very accomplished people. This often means that they have forgotten they are dealing with everyday people when they are looking after a critically ill patient and their families. You and your family don't want to know about the medical language or the medical and academic jargon. You and your family want the information presented in a way that you can understand and make sense of. The next problem is also that many doctors simply think that they are on a pedestal compared to the everyday people they are dealing with. They often don't want to communicate with you on the same level. On the other side, and another problem as well, is that families of critically ill patients in intensive care often think that they have to put the doctors on a pedestal, something you need to stop doing right now. That's what I'm here to do for you. I translate everything the intensive care team is telling you in a language that you speak and understand, and I also show you what you need to look for in between the lines, so to speak. One of the reasons why I started my IntensiveCareHotline.com blog in the first place was that the only information about intensive care I could find online was medical research papers written from health professionals for other health professionals. Those research papers are written in a language that you have a hard time to understand. Therefore, public information about intensive care is almost hidden behind a wall of medical language and medical jargon. Thankfully, you have come to the right place here at IntensiveCareHotline.com. Not only am I advocating for you, for your family, and your critically ill loved one, I also explain everything to you and your family in a way that it makes sense to you. No hiding behind medical language or medical jargon. Number 6. Intensive care teams have scripted what they say, when they say it, how they say it, and what they don't say, so that they stay in control of the interaction at all times. I have said this many times before, and it's so important that I say it again. Most intensive care teams have scripted what they say, when they say it, how they say it, and what they don't say, so that they can stay in control of the interactions at all times. Again, I have seen this over and over again. If you and your family don't know what to look for, and if you don't know how to spot this behavior, you are in serious trouble. It always pays off to be one step ahead of the intensive care team, so that you are prepared for anything unexpected that comes your way. Intensive care can be an extremely frightening, scary, unpredictable and volatile environment, and therefore some preparation, doing your own research, knowing what to look for and knowing the right questions to ask can go a long way in this incredibly challenging journey. Now, the most important situations you need to look out for when the intensive care team is having their responses scripted are in family meetings. Family meetings in intensive care are one of my special subjects, and I have witnessed and participated in dozens of family meetings in intensive care. Most family meetings in intensive care are usually held to deliver bad news. Whenever the intensive care team is asking you for a family meeting in intensive care, you need to be on high alert. Usually, trouble is just around the corner. Most intensive care teams are a master of scripting family meetings in intensive care. Usually, families have no idea in how to get what they want in a family meeting, and they are usually baffled when they are coming out of a family meeting with the intensive care team. Don't be a victim of circumstances and get prepared. I know you might say, Patrick, I don't have the time to do all this research, and I don't have the time to get prepared, and so forth. The fact of the matter here is that the intensive care team knows how to position themselves, as well as your critically ill loved one in a family meeting. They know how to position your critically ill loved one's diagnosis, their prognosis, their care, and their treatment. The intensive care team is the chess master when it comes to selling you and your family on what they want. And they present it to you in a way that everything is quote unquote in the best interest for your critically ill loved one. As a matter of fact, you and your family can't afford not to be prepared. So the question is, what is your positioning? Because positioning is everything. What is your positioning? Do you not just everything off that the intensive care team is presenting to you as being quote unquote in the best interest for your critically ill loved one? The questions that you need to ask yourself is that what you and your family want. What do you want for your critically ill loved one and for your family? What do you think is in the best interest for your critically ill loved one and for your family? Get prepared and have strong mental positioning yourself. Last but not least, now let's move on to number 7. And number 7 is negativity from the intensive care team. This is probably the worst out of all trends. The number of the families of critically ill patients in intensive care that come to me with their questions and concerns say to me that the intensive care team is negative. And that's not only a very concerning trend, it's also something that seems to happen across the board. Given all of the challenges that you and your family are already dealing with, the last thing you need is negativity. Sometimes, if not in most instances, the intensive care team is using negativity to protect themselves as well as their professional reputation. Let me explain. If your critically ill loved one is in a really difficult situation and has minimal chances to survive, the intensive care team will most likely be very quick to point this out to you and therefore will be negative. If they do that, they have protected their professional reputation as well as reduced their risk to be getting sued by you and your family. If they promised you and your family that they'll save your critically ill loved one's life no matter what, and then they can't or won't, you could in theory take them to court for negligence. Therefore, it's a lot safer for the intensive care team to be negative. Furthermore, if the intensive care team takes a negative and limited point of view, it'll be a lot easier for them to impose their mainly hidden agenda on you. By that I mean, if they stay negative from the start, it'll be much easier for them to quote unquote sell you and your family on a withdrawal or a limitation of treatment as being quote unquote in the best interest for your critically ill loved one. Whether a withdrawal or limitation of treatment is really quote unquote in the best interest for your critically ill loved one is up for debate anyway. And as you know by now, the positioning of your critically ill loved one's diagnosis, prognosis, as well as care and treatment from the intensive care team is often a result of what's happening behind the scenes in intensive care. Therefore, you need to question any negativity that's coming from the intensive care team from the start, and you need to have your own strong mental positioning. Period. So, how can you position yourself strongly become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our Contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype or over the phone and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.